Welcome back, everyone. Dr. Shannon Wesley is with us today, proctologist with Midwest Surgical Specialists. We're talking a little bit about Colorectal Cancer Awareness Month. First of all, let's talk about that diagnosis. If you do hear that you've got this, you've got colon cancer, tell us what's happening in your body and maybe who's most at risk for that.
So when you're diagnosed with colon cancer, usually you may hear it from somebody else. When you come into the emergency room, you hear you've had some blood work or something, you need to have a colonoscopy. You get a colonoscopy by somebody that's certified to do those, whether it's myself or a GI doctor or a general surgeon. Some of our general surgeons do colonoscopies. And we find a mass in your colon that we can't remove. So then we move forward with what we're going to do with that. And, you know, we're finding people now are all across the board. So from 25 to 80s, 90s, we get people who are diagnosed younger. We are seeing younger cases of more severe cancers. And the main thing that we always talk about is the symptoms that you're having and what age you should start screening if you aren't having any symptoms.
Are there, you mentioned the symptoms, are there certain things that we should be concerned about?
Absolutely. So I always tell everybody the screening age was 50. We know, we've heard, everybody's talked about it. Over the last few years, they have decreased it to 45. So we do recommend at least having a conversation with your primary care doctor and then probably your insurance company. So if you're 45, yeah, do I think that, you know, you should probably be starting to have a colonoscopy? Does the American Cancer Society think that? I think GI's now on board. The colorectal surgery societies were getting on board with starting at 45. The problem is insurance always lacks a little bit. So your insurance may not think that you need to have a colonoscopy at 45. So you always check your insurance for that part of it. Screening, meaning you're not having any symptoms, you've just reached the age. And then no matter what age you are, so even if you're 17 or you're 85, if you're having symptoms. So what are the big symptoms? And the first one I always talk about, because some people just want to excuse it as other things, is rectal bleeding. So you've heard me probably for the last 7 years, Jeff, say, if you're having rectal bleeding, bleeding from your bottom is never normal. There's no amount of blood that should be coming from your bottom ever. Now, if you had a colonoscopy yesterday or 3 months ago and now you're bleeding, yeah, check up with your doctor just to make sure that it's an okay amount of bleeding for someone who has a diagnosis of something that could be bleeding from your bottom. But if this is new or it's in a large amount or you haven't been evaluated recently, bleeding from your bottom is never normal. I don't care if you're 25 or 30 or 12. So you need to talk to somebody about it. Have it evaluated so we know that it's not something that, oops, 5 years later, we're now in a bigger mess. Other things could be abdominal discomfort that's new to you. So, you know, if you've had some cramping discomfort, you know, well, if I don't have a bowel movement for a few days, my belly gets sore. Okay, that's something to talk to your primary care about. But if that's something that's new out of the blue, you know, we might need to start looking at abdominal pain. Or sudden change in bowel habits. That's a big one as well. You know, you're a regular person and then all of a sudden, hey, now I don't ever have a regular poop. I only go once a week now, or man, every time I go, it's diarrhea.
Anything in our lives, diet-wise, anything like that we can do to maybe prevent it?
So what I usually tell people are like, well, how do you know why I got colon cancer? Well, sometimes, you know, we may be able to link it. Some people do have a hereditary component. Genetics do play a role in some of our colon cancers. So we do know that, and we do have most of the cancers tested for that. When it comes to lifestyle things and getting colon cancer, I always tell people, I'm going to tell you what the heart guys are telling you, what your cardiologist is telling you. You know, exercise a few times a week, be healthy, keep your BMI around 30. You know, eat less red meat. I eat red meat, so I'm not going to tell you not to eat red meat. But if you like your steak, eat your steak. Just don't eat it every day.
Now, the key, as you said, get screened. What's the easiest way to do that? Give you guys a call if we get to a certain age or we have some symptoms?
For sure. So if you're 45, you can call my office or you can call your family doctor and say, hey, I'm 45. I want to start exploring my options as to what I need to do to get screened for colon cancer. And by all means, if you're any age at all and you're worried or you've seen blood or something's changed, your bowels, your belly, something just doesn't seem right to you, by all means, you can always start with your family doctor. They can get you to the right person, or I'm always willing to sit down and have a conversation. And if I'm not the person that can help you, I can certainly get you to where you need to be.
It's easy to do. Dr. Wesley, thank you so much. We appreciate it.
Yeah.
You bet. Nice chatting with you. We'll be back right after this.